Wrist pain can be caused by a variety of conditions. This video addresses the problem with the ligaments on the ulnar or little finger side of your wrist. There's a group or complex of ligaments and cartilage on this side known as the triangular fibrocartilage complex, or to make it easy, the Tfcc. The Tfcc helps hold the wrist bones in their proper position, and it also holds the two forearm bones in place, so when you bend your wrist or turn your hand over, the bones move together properly. Symptoms of a Tfcc tear include wrist pain when gripping, feeling a popping or clicking when you turn your hand over, and pain when you push on your wrist when you get up from a chair. Common causes of a Tfcc tear include falling on an outstretched hand, turning the forearm against force, or simply the tissues weakening from age. Athletes, particularly gymnasts, are prone to these injuries. The first treatment most physicians try is to rest the wrist in a splint. There are a number of wrist splints available, including the ones seen here from 3-Point Products. These splints have varying degrees of support, from a wrist splint that immobilizes the wrist to one that merely supports it. The Carpal Lift Splint from 3-Point Products is designed to support the Tfcc and the ulnar wrist bones without limiting wrist motion. The Carpal Lift has a padded pocket that sits under the wrist bones. The pocket has two straps that thread through the splint to lift the wrist bones up. The splint is wrapped on the hand, and the two straps are used to lift and support the carpal bones. This lifting motion helps to correctly position the wrist to reduce stress on the Tfcc so it can heal. The carpal lift supports the wrist without putting pressure on the ulna or limiting wrist motion. The pad makes it easier to put weight on your hand so it does not hurt when you push a door open or lift yourself out of a chair. The soft foam-lined material is breathable and washable, and washing the splint after use will help it last longer and wear better. Tfcc or other wrist problems are best diagnosed and treated by a physician or therapist. If you have this problem and your doctor recommends a splint, you and your healthcare provider can find more information on the Carpal Lift and other wrist splints by visiting www.3pointproducts.com. Thank you.